they got it in on time, they sent it to the wrong email address. So they showed me the email address that they sent it to. Those two people are going to be allowed to speak on the opponent's side, and someone graciously gave up her time for them. So that gives us 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 speakers on the opponent's side. If we have 10, that's 2 minutes each. Is there anyone who would like to, that's on the list, that would like to give up their time to someone else? If not, we will try to stop you at 2 minutes, but we will have a hard stop at 20 minutes. Any questions about that? Okay, we're going to begin by asking if there are any bill introductions. Seeing none, we'll go straight to the bill brief by Jenna Moyer. Oh, I'm sorry. That's all right. We do have one.
Thank you, Madam. Thank you, Madam Chair. I do have one bill introduction, and it's RS number 0711, which deals with dementia training. It's on behalf of the Alzheimer's Association.
Committee, and objections to this being a committee bill? Seeing none, it has been introduced. Jenna, if you would come up, please, our revisor, and give us a very quick bill brief.
Good morning, committee. I'm Jenna Moyer, Revisor Statutes Office, and this will be a bill brief on Senate Bill 63. As you may have realized, this is very similar to Senate Bill 233 as it came out of conference committee last year. I'll just be giving a brief outline and pointing out some of the differences between that bill last year. The first difference would just be a different name. It's now called the Help Not Harm Act, and you should all have your bill brief that you can read through fully as the time allows. In section 1, it sets out the name of the bill as well as relevant definitions. One of those definitions you should pay attention to is healthcare provider is an individual who is licensed, certified, or otherwise authorized by the laws of this state to administer healthcare services in the ordinary course of practice of such individual's profession. Section 2 prohibits the use of state funds to subsidize, pay for, or promote social transitioning, medication, or surgery for a child as a treatment for gender dysmorphia. One of the big changes from last year is in subsection B. Last year in that section 2B, it prohibited promoting or advocating medication or surgery, and the language was changed in lines 13 and 14 to the individual or entity shall not prescribe, dispense, or administer medications as defined or perform surgery as defined in section 3, or provide a referral to another healthcare provider for such medication or surgery. And additionally, throughout section 2, there's references to as provided in section 3, that medication or surgery. Last year, medication was defined in section 2, and this year instead it just points to, as it is outlined, the definition in section 3. Section 3 prohibits a healthcare provider from knowingly performing certain surgical procedures or prescribing, dispensing, or administering hormone treatments or puberty blockers. For treatment for distress arising from gender dysphoria, except as provided in subsections C or D. And the addition for this year is in line 41. It adds the words for the purpose of for that treatment. And the other change would be similar for subsection B as it relates to male children. That language being added for the purpose of. Section 3, subsection C and D are the exceptions to the prohibitions in subsections A and B. Subsection C is for children who have a verified diagnosis of a disorder of sex development, and subsection D would be the weaning off or the tapering off period that would be allowed to continue hormone treatments until December 31st, 2024. Section 4 is the same, and this would be the civil cause of actions and repercussions. The first one would be a healthcare provider who violates section 3 would be have their license revoked. And then subsections B, C, and D are 3 civil causes of actions. Section 5 prohibits a professional liability policy from covering damages for a against a healthcare provider who provides treatment in violation of Section 3. Section 6 is your standard severability clause, and Section 7 amends the professional discipline statute for Board of Healing Arts licensees to add violations of this act to the definition of unprofessional conduct, and the bill would go into effect July 1, 2025. That's about as brief as I can make it.
Thank you very much, Jenna.
happy to
We
answer
we
questions.
appreciate that. Committee, we're going to go right into our testimony. People have come from quite some distance. I know people have traveled across the state. And for our first conferee is Chloe Cole. And Chloe, are you in the room? And you have 4 minutes.
Thank you for your time. My name is Chloe Cole, and I am a detransitioned 20-year-old woman from California, and I underwent a medical transition from ages 12 to 16. The 3 main interventions I was given were puberty blockers, testosterone, and surgery, starting at 13 and ending at 15. My healthcare provider failed me in several ways, but the worst was pushing me towards medical transition when I was just a child. They should have protected me. I should have been guided with real care and helped to understand who I really was, instead of being led down a path that ultimately would end in early demise. Just to reiterate, that is exactly the truth of transition. It's a series of poisons and body modifications that will ultimately end in an early death for the patient. Increased risk of stroke, heart attacks, higher rates of all sorts of different cancers, blood clots, permanent sterility, early onset osteoporosis, PCOS, stunted brain development, sexual dysfunction, early onset dementia, and of course, regrets followed by extreme depression and grief and suicidal ideation are all things that I think we all can agree that a 20-year-old should not have to worry about. And yet here I am. My therapist and gender specialist ignored the deeper issues that led to me experiencing gender dysphoria. I began puberty at just 8 or 9, and from the beginning, I felt this overwhelming discomfort with my changing body. I was scared of growing to womanhood. Periods, childbirth, menopause, these are all things that I'd only heard described as painful and terrifying. Instead of helping me process these normal fears that I had, I was pushed towards transition as my only option. I never really had any strong relationship with my female role models, and I often felt like I didn't really fit in with the other girls. I had a bit of a tomboyish streak because of the influence of my older brothers. I'd previously been diagnosed with ADHD, though I strongly believe, and much of my family strongly believes, that I'm actually on the spectrum. But this wasn't considered until after age 17, after my transition. The gender specialist who referred me to surgery was the same physician who a year later referred me to a screening for autism. Because I have these behaviors, I was perceived as more masculine. I had a strong preference for object-oriented thinking. These traits, combined with my social and sensory processing differences, were taken as proof that I was transgender and a young man, rather than characteristics that made me think differently. I have some social, cognitive, and sensory processing differences that made school and going through puberty a little bit more difficult for me. I was unmistakably different, but all things considered, most of my struggles were just a result of me being a young teenage girl. I've suffered a multitude of complications from the blockers, the cross-sex hormones, and the surgery. My quality of life is still being impacted to this day. I had my puberty blocked, and in response, my body began to go through an artificial menopause, including hot flashes and itching all over my body. This went away after I stopped taking them, but I still have nerve and joint and spinal issues. During a consultation for testosterone, I was told by my endocrinologist that I would experience vaginal atrophy.
Chloe, thank you so much. And committee, you'll be available if there are questions for you later. Thank you so much.
Thank you.
And next we will go to Jamie Reed. Jamie, thank you for being here, and you have 4 minutes.
Good morning. My name is Jamie Reed. I hold a Master's of Science in Clinical Research Management from Washington University in St. Louis, Missouri. I'm a lifelong Democrat, a mom of 5 boys, and a lesbian. I'm also the public whistleblower from a pediatric gender center. I saw patients from the age of 3 until 26 and worked with nearly 1,500 unique patients. I worked in pediatric gender medicine for nearly 5 years, and I was once a true believer. What I learned is that these are interventions based on poor research, poor evidence, and poor outcomes. Last week alone, 2 new systematic reviews were published in Canada, finding that puberty blockers and cross-sex hormones have 0 to no evidence to support their use. Last night in Queensland, Australia, puberty blockers were banned for those under the age of 18. In the center where I worked, I saw directly the patients who were harmed by these interventions, patients whose mental health got worse after initiation, and patients who mourned the permanent changes to their bodies. This all started with a small group of clinicians in the Netherlands who came up with this idea to transition kids. They were seeking the children they believed would go on to have a lifetime of troubles with their sex and intervene when they were young. Why? Because the transsexuals adults that they were working with were not doing well. When they completed the first study, they found that the young people were proto-gay youth. 68 out of 70 self-proclaimed that they were same-sex attracted, and they transitioned them. Because we were expendable. We were okay to be harmed, to have our endocrine systems destroyed with wrong sex hormones. We were okay to have our fertility taken away. We were okay to have our sexual function stripped away. And then the British repeated this study. They cast a wider net, and this time they caught the proto-gay youth and the vulnerable, the children with autism and trauma, and then they transitioned them. And they hid those results because, again, this is poor research, poor evidence with poor outcomes. And then we in America caught wind, and we cast a huge net across this entire country in every state, and we pulled in whoever could be caught. And now we see this problem. We see the proto-gay youth, the vulnerable, the children with autism, with mental health concerns, with trauma, and they have all been caught in this new group. And now there's a group of primarily girls influenced by TikTok, hurt by COVID lockdowns. These are straight girls with private insurance, with caring liberal parents, and we have transitioned them all. The social contagion is real. And now the problem is clear. The girls began to realize what had been done to them. They stepped up and said, stop, this is hurting us. And we now see the global crisis for what it is, and it needs to be stopped everywhere. To all of the LGBT people listening today, and to the young people in this room who have been sold the lie of trans, you are resilient and strong. You do not need medications to change your body. You should not have to lose any body parts, risk medical harms, or change anything about yourself to be embraced and accepted. We do not have to conform to any straight people's idea of how we should look. Trans is the most homophobic idea ever considered. We were once given electroshocks to make us straight. We were once forcibly raped to make us straight, and now we are being transed. We are perfect just the way we are. No one needs to cut off any body parts to make you authentic. Stop supporting our own destruction and fight back with everything that you have.
Thank you. Next, we have Dr. Van Meters. Is Dr. Van Meters on virtually yet? Okay, we will skip him for now, and we will go to Aaron Lackamp. Dr. Aaron Lackamp. Dr. Lackamp, you have 2 minutes.
My name is Dr. Aaron Lecamp. I'm a critical care doctor.
Could you make sure that is the microphone on?
I'm an ICU doctor and a neurointensivist. My name is Dr. Aaron Lecamp. I'm an introvert, so pardon me for how this comes across, and my statements aren't as prepared as I would like. However, I felt compelled that I needed to come and speak before you. I've had at least 2 patients who have post-transition have come to my care with severe neurologic injury after attempted suicide, and they were in a vegetative state. I'm a neurointensivist, and I feel that it's important to say that suicide prevention is an important thing that we need to address. There are that surgery on children is not going to be an effective means of suicide prevention, and neither would be chemical alteration of the children to prevent suicide. I think there are other more important suicide interventions, suicide hotline, other support infrastructure should be put in place. How many seconds do I have left? I'd also like to real quickly just put in a plug for Aunt Tommy. So my great Aunt Tommy wouldn't wear a dress. She wanted to climb trees, play baseball. She didn't need surgery. I want to put in a plug for the little boy that went in his mom's room, saw the Minnie Mouse shoes, put on those shoes and his mom's coat. He didn't need surgery. I want to put in a little plug for the little boy that put on lipstick, realized it wouldn't wipe off, went in and go see his dad and said, "Whoa, why are your lips so bright?" And says, "That kid didn't need surgery." No, sorry.
Thank you.
Sorry.
Next, we have virtually is Jay Richards on. Okay. Jay, can you hear us?
I can. Thank you very much.
All right. You have 2 minutes. Thank you so much.
Thank you so much. My name's Jay Richards. I'm a director and senior research fellow at the Heritage Foundation. In recent years, the U.S. has seen a huge spike in the number of minors diagnosed with distress over their sex bodies, now called gender dysphoria. Fueling these alarming statistics is an ideology derived from critical theory. This gender ideology displaces the sexual binary of male and female, which we share with other members of the animal kingdom, with a subjective notion of gender identity that's independent of the body. Hence, its champions avoid references to sex. They typically define gender identity as, quote, one's internal sense of gender. Note that this is both circular and unfalsifiable. Because of this ideology, children are now told they might be born in the wrong body. Official groups have replaced sex with a mere social construct, sex assigned at birth. The most toxic fruit of this ideology, however, is in medicine, hence the intervention called gender-affirming care. Gender-affirming is, in effect, sex-denying. These surgeries for adolescents increased not nearly fivefold from 2016 to 2019. As you've already heard, there's no reliable scientific evidence that these treatments improve the long-term health of these minors, let alone that the benefits outweigh the many risks. The harms of these interventions are obvious. In a less troubled world, all doctors would follow the rule to first do no harm. For now, it falls to bodies like this one in the great state of Kansas to protect children from these experiments. Thank you very much.
Thank you. Next, we have Lucretia Nold.
Good morning, Madam Chair and members of the committee. I'm Lucretia Nold, the Public Policy Specialist for the Kansas Catholic Conference, where I represent the Kansas Catholic bishops.
I'm going to interrupt you, please. I forgot to tell you have 2 minutes.
Oh, yes, thank you. I'm here in support of SB 63. And first and most importantly, and many of you may have heard me say this before, but I think it bears repeating, that the Catholic Church teaches that we are to love, respect, and show compassion to all people. And this includes people who do not share or embrace our view of the gift and the beauty of human sexuality. And to just kind of add to that, and for the sake of time, anybody who follows the news probably has heard Pope Francis speak frequently on this topic. And he's been very vocal about providing care and compassion to those who struggle with issues of human sexuality. But he touches on the dangers of harms of gender ideology, and this quote that I'd like to share with you, where he says, "It destroys at its roots God's most basic plan for human beings, diversity, distinction. It would make everything homogeneous, neutral. It is an attack on difference, on the creativity of God, and on men and women." And with that, I would just like to say, if you have any questions about the Catholic theology and teachings on this issue, please find me in the hallway or after this meeting anytime. Otherwise, I will stand for questions at the appropriate time, and we support SB 63. Thank you.
Thank you. And next, we have Brittany Jones.
Thank you. Madam Chair, members of the committee, my name is Brittany Jones, and I am the Director of Policy and Engagement for Kansas Family Voice, as well as an attorney. At Kansas Family Voice, we believe that every child should be loved and valued and respected for who they are and who God made them to be. We represent thousands of Kansas who support SB 63 and believe that children's innocence and their bodies should be protected. We know that the threat of drugs and these procedures are happening in Kansas. There are reports of over 19 different facilities that have performed these procedures and these drugs and, in the state of Kansas. And most Kansans that I talk to every day are horrified that this is still happening in the state of Kansas and believe it is high time that this body do something about it. I urge you to join the 23 states, the multiple countries, and other bodies that have rejected this experimental and harmful procedures for minors. I ask that you join with the states that are going before the Supreme Court even now to defend these kids and to support their right to grow into their natural bodies and to learn to accept who God they made them to be. So I ask that you support SB 63, and I stand open for questions at the appropriate time.
And I understand from our IT that we still do not have Dr. Van Meters on virtually. This group used, I think, 16 minutes. So we will have committee 4 minutes for questions of the proponents. And if Dr. Van Meters should come on during that time, if you could let me know, please. And we're going to have we have time in that 4 minutes for one question. Please, committee, do not use more than your one question. Senator Holscher.
Thank you so much. I think my question is probably best directed to Brittany as an attorney. I'll give you a second. If I understand the bill itself, Section 3C carves out and basically says this care is in regard to intersex or cisgender children with hormonal imbalances. So if I'm understanding correctly, that carve out means that the treatment is still available, but this bill is basically targeting trans.
Senator Gossage, Senator Holscher, this bill is about protecting kids from these harmful experimental procedures, and it is for the purpose of, it only bans those procedures for the purpose of gender transition. This is an argument that was made at the Supreme Court just last month, and the justices there seem to support the conclusion that the state has the right to regulate the medical practice.
Okay, so if I may follow up, so.
Sorry, we don't have time for a follow-up. Are there other questions? Okay, no questions, so you may have your follow-up.
Come back. Now that you sat down or got ready to sit down. Sorry about that.
I need the exercise. It's good.
Okay, so just as the follow-up then, the language is explicit then to only trans care.
It is for the purpose of Senator Gossage, Senator Holscher, it is for the purpose of treating gender dysphoria that those procedures are banned. They're available for other purposes. They're available if, a child is, the cross-sex hormones are available if the child has precocious puberty or other things. That's been something that medical practitioners have been doing for years to help children meet a natural puberty timeline, but they're not available for the purposes of gender transition, which has been proven to be harmful and experimental.
Thank you, and thank you, Senator Holscher. I have a question for Jamie Reed.
I'm gonna let her sit down this time.
I was up very late reading all the testimonies last night, and the question I have for you is, you said you were a believer when you went in, you started working in the clinic, thought you were helping people. When did it become clear to you this was hurting people, not helping?
Actually, quite quickly. The doctors in this field are really at odds, and they're not even quite clear what they're doing. One of our clinicians believed that they were treating a mental health disorder called gender dysphoria. The other clinician believed that if children requested this, that they should just be able to get what they request, essentially putting the medical decision-making into the hands of children. I recognize these two clinicians were at odds within the first year, And as I go through the literature, Annelou de Vries, which is a clinician who created this out of the Netherlands, just published a paper a month ago also stating the evidence is so poor that we really should just give this to kids if this is what they want, which is completely outside of the norms of any medical ethics.
Thank you very much. And do we have the doctor on yet? We do not. Okay, we will proceed. Yes. Oh, I'm sorry. Senator Thompson, you're at 41 seconds now.
41 seconds. Just a real quick question for Chloe Cole. And I'll go ahead and ask the question while she's on the way up so she can take her time. One of the things that I hear from some parents, they're frantic and they're panicked over what's happening with their kids, and they think that the only choice is to have surgery or use the medical, the pill, whatever, puberty blockers. What would you say to those parents who think that they're going to lose their kids to suicide, and this is the only option they have?
That's exactly the lie that they gave my parents. They told them that I was going to be at risk of suicide if I were not allowed to have these treatments at the age that I was. But even if I were suicidal, this would not be the way to address that. Medical professionals are trained not to talk about suicide in a black or white manner, and saying that something is or isn't going to cause suicide is going to cause more suicides. But the best outcome for these children is to allow them to grow up with their bodies fully intact, to allow them to understand themselves as they are with everything that makes them unique. Because eventually most children will grow up to be comfortable with their sex and with their bodies. That is the best possible option that we can give them.
Okay.
Thank you, Chloe.
Thank you.
Thank you.
We're ready to move now to the testimony of the opponents, and we're going in alphabetical order, except for the two additions at the end. So we will start with Anthony Alvarez, and you have 2 minutes. We have 20 minutes total, so if you don't need your full 2 minutes, we would appreciate that to make sure everybody has an opportunity to speak.
Chair, members of the committee, thank you. My name is Anthony Alvarez. I am a Kansan. I'm 20 years old. I am a member of Senate District 4, and I'm a transgender man. I am speaking in opposition to this bill. I came out and began transitioning at 16, being supported by my family, friends, and healthcare providers. Almost immediately after beginning my transition, everyone around me and I began noticing positive changes. I was more confident, consistently happier, and overall seemed more present. My transition was supported by my teachers and administrators while in school. They allowed me the dignity of being treated like any other young man in their building. This opportunity was immeasurably important to me, as including extracurriculars, I spent around 50 hours a week there. I could not imagine how it would feel to have the place where I spent the majority of my time feel hostile to me. Looking back now at my decision to transition and my time in school, I recognize how life-saving the medical recognition, the medical care and recognition I received was. Being able to start transitioning as a minor allowed me to begin my life as soon as possible. When I think about the medical care I received, I remember that everything my parents questioned or had doubts about was addressed. Never once did we feel pushed to begin a medical treatment that we were not fully made aware of all the facts of. I feel extraordinarily fortunate to have received that level of care, and it pains me to imagine that other young Kansans one day might not have this care available. Receiving gender-affirming care as a minor and having support in school were life-saving interventions that allowed me to begin my adult life. I urge the members of the committee to think about the young transgender Kansas in your care when you vote for this bill. Thank you.
Thank you. Next, we have Andrew Cox.
Members of the committee, my name is Andrew Cox, and I'm an 18-year-old resident of Leawood, Kansas. I have formally submitted testimony that goes into detail about the following positions. 1, gender-affirming care, whether for adults or minors, is supported by leading medical institutions as documented by the American Medical Association, the American Psychological Association, the American College of Physicians, and the American Academy of Pediatrics. Gender-affirming care, whether for adults or minors, is both beneficial and potentially life-saving, as has been documented by many peer-reviewed studies. And current research has shown that in states where gender-affirming care for minors has been prohibited, have seen rates of suicide in trans youth rise as much as 70%. But I don't just have the science to back this up, I also have the Constitution and Supreme Court precedent. Supreme Court has ruled in the past that states can interfere with medical decisions made by people. However, only if in the interest of the state. This ruling was initially made about a man refusing a smallpox vaccination. Considering the fact that this bill would not ban these procedures for anyone other than those who are experiencing gender dysphoria, it is clear that the procedures themselves are not considered dangerous. So the only real conclusion you could come to is that the committee views trans people as a threat, which I'm sure was completely unintentional. I would also like to point out that this violates parents' rights to make medical decisions for their children, a case that has been established many times by the Supreme Court. I would also like to point out that SCB 63 contains vague language that could compromise the ability of teachers, of counselors, of other people who work with children to effectively do their jobs under the risk of promoting or any kind of gender transitioning, whether that's social or medical. And I would like to ask you the following questions. Are you going to vote
Andrew, I'm sorry. Your time is up. Thank you. Next, we have Johnny Dunlap, who is a private citizen, and he is virtual. Johnny, are you with us?
I am. Can you hear me?
We can, and you have 2 minutes. Thank you.
Thank you. First of all, thank you for allowing me to do this. I'm testifying as an educator. I've been a teacher for 11 years now, and I can tell you without any doubt that this bill will affect my ability to teach children. I can tell you that if we stigmatize kids who don't follow a regimented ideology that this bill is pushing, they will be bullied, they will have no one to turn to, and they will feel betrayed by the people that they're supposed to trust. I think that this bill goes too far. I think that it, as an educator, I do not check my First Amendment rights at the door, right? And when a kid says, hey, my pronouns are this, or hey, please call me by this name, I'm going to do that. That's basic human decency, right? Giving them the dignity to choose how people interact and refer to them. It's no different than somebody named Robert insisting on being called Bob. It's maddening to me that this bill would keep us from doing basic interactions with our students. And I think it's worth pointing out to this committee that Kansans rejected the legislature interfering in medical practices when we rejected the amendment to the Constitution banning women's health care just a couple of years ago. And I think that this is more of that. This is the state trying to dictate what medical care Kansans can and can't have, and I think that's wrong. And please do not pass this out of committee. Please allow me to do my job in the most effective way possible. Thank you.
Perfect timing, 2 minutes. Thank you very much. Next, we have Elise Flatland.
Good morning, Madam Chairwoman and members of the committee. I am a volunteer with Equality Kansas, but I'm here today on behalf of my family. I'm a mother of 4. I'm a Kansan, and 2 of my children are receiving gender-affirming care. My son has always been the happiest child I've ever known. Since he was a toddler, we called him Sunshine for his infectious joy. However, when he was 10 in 4th grade, that all changed. He began waking up in tears, and I would have to physically carry him into school while he was fighting me to avoid going. That winter, we discovered cuts on his arms and legs. He admitted that he was cutting himself with scissors. We locked up all sharp objects in our house, and still I found cuts. My son admitted that he was going to the restroom at school and cutting himself there. A safety plan was put in place, and still, months later, the school called me and said that they could no longer keep him safe. He was admitted to a psychiatric hospital as a suicide risk. It was the worst feeling as a parent to know that I could not keep my child safe from his own pain. After diagnosis and medications, our son began to recover. We will never forget the day he came home from school and told us he had the best day ever. And it was simply because he asked his class to call him by a new name and told them he was a boy. After his mental health was stabilized, he was diagnosed with gender dysphoria. And we sought a doctor who specializes in this care. Today, my son knows who he is.
I'm so sorry. Thank you. And next we have DC Hegard. Is it Hegard? Hegard. Thank you.
Those German last names with all the vowels, tricky. My name is DC Hegart. I'm a lawyer testifying on behalf of the ACLU of Kansas. We stand strongly opposed to SB 63. This bill likely violates constitutional rights of Kansas children, parents, therapists, doctors, and teachers, and poses an unprecedented threat to Kansas families by banning the only evidence-based healthcare options available for youth experiencing gender dysphoria. SB 63 forces the government into healthcare decisions that should be between a provider, the patient, and the patient's family. And it violates Kansans' constitutional right to personal autonomy, which the Kansas Supreme Court said, quote, includes the ability to control one's own body, to assert bodily integrity, and to exercise self-determination. The United States Supreme Court is also poised to issue a ruling in a lawsuit dealing with a similar bill out of Tennessee, and that ruling will be controlling here in Kansas. Passing new bills restricting this care now would waste critical government resources and taxpayer dollars, as all states will receive guidance from the Supreme Court on the legality of such laws in the coming months. In addition to the legal concerns of this bill, it also threatens Kansas medical providers with lawsuits and license revocation for simply trying to do their jobs. And it doesn't stop with medical providers. It also attempts to ban aspects of social transitioning by implicating state-funded facilities and state employees in its limiting provisions, raising extreme concerns about this bill's reach. I'm sharing this testimony as an ACLU lawyer, but also as a lifelong Kansan and a transgender person. The very care this bill attacks is the reason I'm alive and able to advocate for my fellow Kansans' rights. I love Kansas, and I'm proud to call it my home. I know countless other trans people in our state that feel the same way. But bills like SB 63 tell us our state does not love us back. Please don't make it harder for these young Kansans to live their dreams and contribute to our state, their families, and our communities. We urge you to oppose SB 63.
Right on time. Thank you so much. And Emerson Hofsalas Committee has offered to give up time to another conferee, so we go next to Isaac Johnson.
Thank you for allowing me to speak today. I'm a lifelong Kansan named Isaac Johnson, and I'm an LMSW who was driven to work with children as a social worker because of my own struggles in childhood. My time as a school social work intern put me in contact with dozens of kids and teens. The relationships we had were so valuable because of how few adults they could trust. I'm in agreement with the committee when we say we want to help rather than harm children. However, I worry that this bill would do the opposite. Although this bill mentions that our First Amendment rights are still protected, the definition of promoting transitioning is vague. The number of conversations I could have to shut down is broad for all kids, not just trans kids. This does not protect children. Instead, the fact that I would have to reject them only pushes them away from adults that can help them. The main danger facing the students I worked with wasn't transitioning. It was violence, poverty, drugs, and more. Additionally, I worry that this contradicts my code of ethics as a social worker, which requires me to respect all people and their autonomy. This bill threatens my security and efficiency as a social worker. Impaired relationships with children drives them to self-harming behaviors, including suicide. And for that matter anyway, as someone who could not be out publicly as a gay trans man until I was 23 years old, not being allowed to express that part of myself only worsened my quality of life. I wasn't going to mention that I'm trans originally because I never mention it with my students, but it seemed relevant to mention here. I understand the concerns you may have, but this bill doesn't adequately address them. To continue the well-being of children and the ability of Kansas workers to do their jobs, I implore you to vote no on SB 63. Thank you.
Thank you. Next, we have Christy Kahn.
Honorable committee members, my name is Christy Kahn and I live in Colby. I'm a concerned constituent here to talk about SB 63. The reason this bill is so important to me that I made the trip all the way from Colby here today is that my one and only child was transgender. I say was because he completed suicide in his dorm room because of bills being passed just like this. He was made to feel like his life did not matter, that he did not deserve to live, by bullies not only in his school, but from adults and politicians who have decided they know better than him or others like him, us parents, and the doctors and specialists who have the knowledge and expertise in this area. Those who attack transgender people, young and old, have no idea what is involved or what our families go through. I did everything I could to help my child. I took my son all over the state seeking help from experts, hoping that they would say it's just a phase, but I realized it wasn't. People like to say we or the schools or social media are pushing our children to be transgender, which is not true. To those who say irreparable harm is done to our children and it's just mental illness, I can tell you from experience, this is not a decision made lightly, with a lot of research involved and a lot of appointments with therapists, psychiatrists, and doctors who explain the whole process. We know what's at risk. There's a long process of steps, starting with social transitioning, just changing hair, clothing, name change. Eventually, one day, they start hormones. And when my son was allowed at 18 to make a consult, just to make the consult, he couldn't even have that consult for 1 year. And he had to have letters from his doctor, his therapist, his psychiatrist, making sure that he was ready for that step. But he never made it that far.
Thank you very much. And next we have Reverend Charles McKenzie.
Thank you, Chair and Committee. I'm Pastor Charles McKenzie. I come from Grace United Methodist Church in Winfield, Kansas, and today I stand on behalf of also KIFA, Kansas Interfaith Action, which is a group of houses of faith across this state that stand with one voice today in opposition to this bill. You can read my testimony, and I hope you will. There's lots of facts, there's lots of data, and I think that if we were having a productive conversation actually about the guardrails around healthcare, we could do that, but I don't think that's where we are today. This bill goes all the way into addressing social transitioning, which is harmful, which is hurtful, which is immoral, and so instead of wasting my time and your time to say what you can already read, I'm going to take a book or a page from this book, the Old Testament prophets, which for those of us who remember what we learned in Sunday school growing up, the prophets did three things. They announced the injustice happening in the world. They called for us to turn around. And third, they then announced the day of the Lord that was coming. And so I just want to remind us that as we stand here today, as we sit here, as we hold places of power, we have the ability to do good, we have the ability to do harm, and we have the responsibility to know the difference. I call on you, please see the harm that is potential in this bill. Do not move forward with it as it is, and please let us turn around and turn away from this. And I would just remind you that I am someone standing here today who has come from this state with the perspective of this state. I am not brought in, I am not paid for to speak to you today. I am here on behalf of Kansans.
I'm sorry.
And I appreciate the time to address you, and I truly appreciate your thoughtful consideration. Thank you.
Thank you very much. And next we have Jamie McReynolds.
Good morning. My name is Jamie McReynolds, and I currently work as a nurse and live in Lenexa with my husband and young children. Thank you to the committee for the opportunity to have my voice heard today. I'll start by saying that I really love all of the sentiment in support of this bill about children being encouraged to embrace their uniqueness and differences and love themselves in their entirety. I love that. But it is not the answer for everyone. And it is not the government's business to interfere with these decisions. Allowing the government's interference here is at best a very slippery slope. Again, in response to testimony we've heard today, it should also be pointed out that there are no laws preventing parents from exposing their kids to secondhand smoke or ultra-processed foods or sugary drinks or aspartame or social media. all of which have known dangerous long-term outcomes. As our elected government representatives, we are relying on you to help protect our civil liberties, protect our bodily autonomy, freedom of expression, our ability as parents to work together with medical experts to make the best possible medical decisions for our children. It is the sacred duty of our elected officials to help pass legislation that protects our children from actual imminent threats like gun violence and underfunded public schools, climate change, inadequate access to health care, rising grocery store prices and cost of living. It is not the job of our elected officials to protect people from feeling uncomfortable because someone makes an informed medical decision for their children with which they disagree, or because a child is wearing something that doesn't match their birth-assigned gender. And yes, in addition to medical intervention, this bill addresses social transitioning, including manner of dress and pronouns. I don't know what the answer to some of these difficult, complex questions are, questions about sports integrity and the long-term effects of hormone therapy. And unfortunately, there will be poor outcomes, a few of which we have heard about earlier this morning. But I am sure the answers to these questions are also complex. The answer is not as simple as stripping rights from a marginalized group of people. History should have taught us by now that this has never and will never be the right answer. And it is also a very slippery slope. Kansans are smarter than that, and I think we can come together to find a better solution. Thank you, Madam Chair and Committee.
Gabrielle Padilla.
Thank you, Chair Gossage and members of the committee. My name is Gabriel Padilla. I'm from Wichita, Kansas. I'm here today to speak in opposition to the proposed legislation that wants to ban gender-affirming care for minors in Kansas. As a transgender man out for 11 years and 9 years of experience in the classroom, I can tell you that this legislation is more harmful than good. I'm a math teacher with privilege of working with students of all backgrounds, experiences, and identities. Today, I stand in opposition to Senate Bill 63 because it fundamentally violates the rights of the children and their families. Every student, no matter what age, should have the autonomy to decide what is best for their bodies. As a transgender individual, I know firsthand how critical it is to have the ability to make informed decisions about one's own identity. And I believe that the rights to every young person, especially those most vulnerable. The choice to affirm one's gender should not be dictated by the government, but by the person living in that body and their family. No one knows a child better than those who love and care for them. Children are entitled to respect, compassion, and support as they navigate their journeys. By imposing restrictions on gender-affirming care, we are not only infringing upon the rights of freedom, but we are also sending a harmful message that their identities do not matter. Every person deserves the dignity to express themselves fully. No law should stand in that way. Thank you for your time and consideration. That's all I got.
Thank you. And finally, we have Stephanie Johannes.
Members of the committee, sorry. Are we ready? I'm sorry.
Stephanie, they're telling me that 20 minutes is up, but I can give you 30 seconds. Go ahead.
Thank you. Members of the committee, my name is Stephanie Johannes. I'm a public high school math teacher and club sponsor from Salina, Kansas. I ask that you oppose this bill because I believe it will be much more difficult to educate my students in the classroom. Anytime we see parents' rights taken away to make decisions about their own children, we see decreased learning outcomes. Students don't feel as safe to express their values, beliefs, opinions about their learning, and they can't relax because they see at home that their parents are stressed, that they're uncertain if other rights are going to be taken away. So I ask that you please consider opposing this bill. Thank you.
Thank you for your understanding. Committee, I have 9:21. We must all be completely out of this room by 9:25. So we have, and now it's 9:22, so we have 3 minutes for questions. Committee, are there questions for the opponents? Seeing none, we will conclude this hearing on Senate Bill 63, and committee, we are adjourned.